Ed, thanks so much for joining us.
Thanks for having me.
For folks who haven't been following this story, they may be shocked to hear that foster kids have been living in offices. Can you just paint a picture of what that's looked like?
Yeah, over the years, it's a problem that's gotten worse and worse, really starting with the closure of all the residential treatment centers in New Mexico in the early years of Lujan Grisham's term. What's been happening increasingly until this executive order is that, there's a group of kids, mostly teenagers, who just have needs that are too high for traditional foster homes. And so there's a shortage of foster homes, there's a shortage of appropriate placements, and the kids will be placed in a shelter somewhere, run away, and then eventually they run out of places to put them, so they go to the office, right? And in some cases, just sleep on a cot on the floor in the office for on and off or for an extended period of time for a good part of their teenage lives. There's also a group of kids who have medical conditions, kids who might be in wheelchairs, on feeding tubes, things that a foster home can't handle, given the resource shortage we have. Those kids were also living in the office.
So these are a particular population of kids, some of whom are medically fragile.
Right. Right, and these are, what they call hard to place youth, right? These are kids that aren't like the babies that have an easier time finding a traditional foster home. Kids with, high needs, serious trauma-related issues that just, they need more care than the foster system's been equipped to give them. There's nowhere else to put them, they end up in the office. And so that was happening more and more and more. And recently the situation kind of changed.
Right, so as you're saying, this was a years-long crisis, really, and then in January, the governor issued an executive order that started a 40-day countdown clock to end this practice for good. Did Lujan Grisham provide any kind of resources or support to CYFD to get that transition done?
No, and that's been one of the big criticisms of the executive order, right? Like ever since the Kevin S. Settlement, which was a big, legal agreement that was entered into like 6 years ago, the state has been under an order to stop putting kids in office and develop a system of mental health care and a foster system that can handle them. That's never happened. So
and that was a court order that they never then complied with.
That's right. It was a settlement agreement coming from a class action lawsuit that found that the state of New Mexico was locking its foster children into a cycle of trauma and destruction, basically by not having appropriate placements for them. And so they were supposed to end on not just office stays, but congregate care stays, entirely under that order. It never happened. So to just kind of wave a magic wand, the critics say, and say no more offices. Well, the problem is there's no supports to make that happen. So it's a dangerous situation for kids who, the office, certainly everyone agrees, wasn't a good or safe place, and we can get into some of the, scary things that have happened there. But where else are you going to put them? And the executive order, no, it didn't have any supports like that.
Well, despite that, according to the governor, not only did they meet that March 1st deadline, they got it done early and met it by February 12th. What do we know about how they got it done with no additional supports when they haven't gotten it done for 6 years?
Very little. CYFD hasn't given much clarity on exactly how they made that happen. They've said that we've put these kids in safe placements. But we know that those safe placements just don't exist to the level that they need to, right? So maybe you found a temporary situation in a foster home or a shelter where you can have a kid live for a little while, but remember that these are kids who have, serious mental health needs for the most part, right? That they're not getting psychiatric services in shelters. Unless it's a treatment foster home, they're not getting those kinds of services in a foster care family. So inevitably, the cycle has been over the years that the kids reach some sort of crisis, whether it's running away or a suicide attempt or a violent outburst, and then they're out of that placement. So we don't know exactly where, where they put them. They did give some answers to that.
Yeah, the acting secretary, Valerie Sandoval, thanked the, quote, many partners who have stepped up to help place children in safe and appropriate settings. So if they're partner organizations, do we know if these are state partners? Are they public entities? Are they private companies?
Yeah, again, it's kind of a vague, shout out to someone we're not clear what exactly they're talking about, but they could be talking about shelters, youth homeless shelters, treatment foster care organizations. These are nonprofits that run kind of a higher level foster care. Presbyterian Health Services, who runs the Medicaid, and we don't exactly know. They did say to Esteban Candelaria, a reporter at the New Mexican, that they'd put the majority of these kids, I think 10 of them, into foster homes. 6 of them, if I'm remembering the numbers correctly, into shelters or congregate care settings, and some kind of in a smattering of other placements. Several have been put in the hospital. We mentioned the medically fragile kids that were in the office, and I know at least one, and I think more, were put directly into a hospital bed after the office closed because there was just nowhere else to put them.
Looking at this patchwork, and it's pretty vague what makes it up, but is there a concern about oversight, that CYFD is able to oversee these different sites if they are partner organizations, hospitals, the smattering of other places that you're talking about?
Well, I mean, there's been a really significant staffing shortage at CYFD. The turnover rate is really astronomical. I mean, Bernalillo County had like 100% turnover rate of protective services workers on a recent evaluation schedule. There, in terms of oversight, is CYFD able to make sure these kids are safe?
Yeah.
I mean, their placement worker, their social worker should be visiting them and making sure that their needs are met. But remember, these workers have incredible caseloads, more kids than any one person can reasonably be expected to handle. So I think the realistic answer is no, there's not enough employees at CYFD to give the kind of oversight that really is needed.
So is it an assumption then that these new placements are necessarily safer than the offices that these kids were living in? And is there a way to actually determine that? Or is it just, offices are clearly an inappropriate, unsafe environment for a kid to be living in, so of course this is better?
I think, it's going to depend on the place they were sent to. The governor's executive order did say they have to be in safe placements, right? But the problem is okay, we have a number of kids in residential treatment centers that were from the office. These are placements that were shut down by the state, and the Kevin S. lawsuit specifically singled out as dangerous for children, right? There's been so many cases of abuse and mental health trauma that occurs in these, congregate care settings that I don't know how you can make the argument that now they're suddenly safe. And of course, we don't have but a very, very few number in New Mexico anymore. So these kids could be going out of state to congregate care RTCs where their caseworker is probably not visiting them because they could be in Texas or who knows where else.
It sounds like this is not a long-term solution. How sustainable is it?
It's certainly not a long-term solution. I mean, like I mentioned, the pattern of these kids kind of escalating in these inappropriate placements and then blowing out of them, we can't expect that to just disappear because there is an executive order. So, the question is, what's going to happen when they do and when these current placements are no longer viable for them? Are they going to be on the street? Are they going to be, in a situation they could be exposed to human trafficking? It is not a secure long-term solution, and on the backdrop here is that the state has year after year failed to provide the kind of infrastructure it needs to make those placements stable. Like, we don't have a single mobile crisis unit, a step-down facility, all these things that most other states might have to make sure that when a kid does get into a serious mental health situation in a foster care setting, that can be addressed, right, without sending them to a hospital.
And then they don't just lose the placement that they're in.
Exactly. And so, the concern is that these kids are going to be bouncing again, right, from these placements, and now they don't have the office to fall back to. And, there is certainly a lot of concern about the safety of those kids when they do inevitably kind of bounce out of these temporary placements.
You've mentioned the Kevin S. settlement and that the state has been under an order to end office stays for 6 years now and haven't gotten it done. So if that's the case, then what's to keep CYFD from violating this executive order?
Well, there's nothing in the order that specifically lays out any consequences for that. I mean,
no accountability mechanism there.
an office stay would be, would not be a legal stay. You could argue that that's been the case since the Kevin S. agreement was signed in the first place. But and they have created a new kind of receiving center, they call it, as in Las Cruces, which is basically an office. It's not an actual office, but it's being used the same way, right, as a short-term housing opportunity for kids with nowhere else to go. So
they're making options available that aren't technically offices, but serve that same catching any kids.
Yeah, I
that
guess the
don't have
difference
anywhere
that
else
I
to
see, if it's a receiving center, is just it doesn't have CYFD employees in a cubicle in the same building, right?
Okay.
But other than that, the licensing standards, I'm not sure what they would be for that setting, but it seems to be a very similar process. Now they are making new progress, I think, to try to address these things. But it's a monumental task. Obviously, the state's been trying for over half a decade to get it done and hasn't been able to.
Well, and speaking of Kevin S., just last week, as we were talking about this interview, a new remedial order came down. What can you tell us about what that includes?
That was a remedial order basically addressing some of these shortfalls that we've just been talking about, right? Like the state hasn't moved forward on key targeted outcomes for the Kevin S. agreement. And so some of the things that they talked about, one of the notable ones was treatment foster care. And we said earlier that this is the kind of enhanced foster care, right, that is supposed to deal with kids who have greater mental health needs. There has been a huge denial rate for referrals to treatment foster care organizations recently, over 85%.
What's driving that?
Well, the directors of the treatment foster care organizations say that the referrals we're getting, these kids are not, appropriate for this kind of care. They need a higher level of care. They need, in some cases, a congregate care setting, which is, of course, the kind of setting that we're trying to put a stop to.
The agreement said that congregate care, like a homeless shelter, for instance, isn't an appropriate placement either.
Right, that's true. And so, but from the perspective of the treatment foster care, clinical staff and directors, right, they're getting a referral and seeing, maybe this kid has a criminal history, maybe they've destroyed property in a CYFD office. And that's something that's happened really, frequently, right? And their fear is that this is not clinically appropriate for us to put into a foster family home, even if there's more services available, because it's not safe for the foster family and it's not safe for the kid.
Is there anything about the remedial plan that gives you hope?
Well, so one of the things that they do is direct a lot more analysis of that referral process and why they're getting denied to treatment foster care. And there's other things in that order as well. But the hope being that we can identify some of those kind of barriers, right, and then provide the services that we need to make those placements work better. I know, talking to the Kevin S. plaintiffs, that they are more optimistic now than I've heard them be in a long time about the outcome, of this remedial order and the potential for things to actually get better at this point. And so that's been a change, because it's been kind of a huge frustration for the people involved in that settlement that we've been, just nothing changes, And so CYFD does have some new people, including the COO there that got another child welfare agency out of a remedial order or out of a settlement agreement in another state. So there are people on the team at CYFD that people have faith in that could actually move the needle this time.
Now, we are reaching the end of Governor Lujan Grisham's term. It took her 7 out of the 8 years of her terms to get this done in terms of the office stays ending. Will the prohibition stick, or does it have enough time to stick before we get a new governor in office in January?
That's a great question. I mean, I guess it all depends on whether or not they're able to make these kind of ad hoc, emergency placements work in the long term. I'm skeptical that they will. And, that, again, is the great concern. What happens when these kids run away, or they just feel that they're not getting the care that they need, or, is the state equipped to handle that emergency when it inevitably arrives? And I don't, at this point, I think the answer is no. But if they're able to really, hustle and get some services available to these kids, maybe the office closure can be, a positive step that lasts.
I mean, you've spoken this a little bit in terms of one option would be that kids run away. They're no longer in the system. But if this order gets changed, it doesn't stick. The next governor has different ideas about how to comply or not comply with Kevin S. Where does that leave the kids that are in CYFD care?
I really think that's an open question at this point. I mean, I think there's a lot of people that would probably welcome a new set of leadership and just kind of a hard reset, and probably a lot of people that say, well, now we're making progress, so changing track now might be destructive. We really haven't heard this come up that much on the campaign trail so far. So I'm going to be really interested to see what ideas the candidates have, come November, and what that might mean for kids.
All right. Ed Williams, thanks so much.
Thanks, Matt.